everyone. So my name is Tim Kelsey. I'm the National Director for Patients Information in NHS England. Can everyone hear that? The acoustics aren't brilliant. And my role is an unusual one in a public service. It combines responsibility for all technology policy and procurement commissioning. It involves all the information policy and strategy, and crucially it also involves all our work on public and patient participation. And the reason that we brought these things together was that the kind of history of technology, a little bit the history of technology in health and care services, at least in the UK, has been one in which technology has been divorced from the kind of strategic mainstream of the health service. So the idea of putting technology and information together with the responsibilities for the customer, in effect, seemed like an important strategic commitment that NHS England is making to truly unleashing the power of these extraordinary enablers to properly improve the quality of patient outcomes. Now, I'm actually not going to talk too much about technology because, to be absolutely honest, I know very little about it really. I'm going to talk about people, and I'm going to talk about what we urgently need to do to unleash the power of people through information in particular and technology. And the way I think about this is to think of it in slightly different terms. So my priorities are transparency on the one hand and participation on the other. In both cases, of course, technology is a vital ingredient, perhaps the most important key precondition, but actually the objectives I have are for data to flow and for people to be able to become much more active, both in taking control of their healthcare, but also in participating in decision-making about what kind of health service they get locally. And one of the reasons why I took this job, I don't know if people know my background, but I was originally a journalist, and then I worked briefly for the Prime Minister. I set up a company called Dr. Foster, which is a business that promotes kind of data on hospitals and other health services. And then I worked for the Prime Minister on open government. I was the UK government's Open Government Director, and that exposed me to a whole kind of new world, I'm sure many of you are familiar with it, in which technology has just totally changed the way in which citizens interact with all sorts of public services. And I don't know how many people here have heard of Ushahidi. Has anyone ever heard of Ushahidi in this room? Any hands? Okay, so after you've heard me talk, you should go and look at Ushahidi. It's USHAHIDI.com. And Ushahidi is the Kenyan word it's Swahili word for testimony or witness. And Ushahidi was set up in 2008 by a couple of Kenyan emigres at the time of the last election, which I'm sure people may remember was a very difficult and tense period in recent Kenyan history, in which basically the ruling party just brutalized the opposition into submission and rigged the election. What Ushahidi was a platform to allow the opposition, and really anyone at all, to instantaneously report incidents of violence against local communities who were trying to run the election in a proper, reasonable fashion. And so quick, so enormous was the national response to this opportunity that very, very rapidly a map could be created, which literally in real time told you where government forces were going and the risks that local communities were running in basically trying to run an election. It became so obvious, the degree of brutality in Kenya, that the UN intervened, spoke to the Kenyan government, and the brutality stopped. And all because of effectively a crowdsourcing platform, some very cheap technology that liberated the voice of the oppressed in Kenya. Now, Ushahidi since then has become an amazing phenomenon. It's now the preferred platform for all crisis management in the world. Pretty much every government uses Ushahidi. So when the Haitian crisis happened, for example, Ushahidi was the technological platform which allowed Haitians to text or tweet the safety of local roads, the viability of roads after the catastrophes, so that aid agencies could be certain which roads they could send their trucks down. And they basically rescoped the map of Haiti using the Ushahidi platform. So that's kind of just one example, which I found very inspiring and in a way changed the way I thought about what open government means and subsequently, of course, now really makes me think hard about what we mean by patients, or by sort of how can we best liberate the patient, the citizen, in pursuit of helping themselves produce better healthcare. When we look at, so we have those sorts of examples of the internet effectively, those sort of low-cost cloud-based technologies just changing the way in which governments and which societies run, and there are lots of other examples. And then we look close to home, we're back in England, and we look at the rest of our lives, and we can look at things like online banking, and we can reflect that there again a combination of transparency, i.e. access to our own data, and participation, the ability to do things with it, has completely transformed our relationship with our banks and with our own money. And an interesting fact, which if some of you have heard me speak before, you may have heard before, but if you haven't, it's worth remembering and repeating, is that online banking started back in 1998 in the UK with a bank called Kahoot. And I guess people in this room will have been as skeptical as I was about the very possibility that banks could be trusted, that digital technology could be trusted to safely manage my money. Anyway, in 1998, none of us were doing it. It didn't exist. Today, more than 22 million adults, which is more than a half of the adult population of England, only do online banking. And the net result has been not only a massive increase in customer satisfaction with the service they're provided, and indeed a whole new creative layer of innovation in the sorts of services that are being provided, but perhaps more importantly, just being brutal for a minute, it reduced the cost base of retail financial services by about a third. Now we need to repeat the same kind of miracle of deployment of transparency and participation to get, frankly, the patient and the citizens to start doing more of the work for the NHS than is currently the case. Effectively, the banking trick was to offer us the chance to be the clerks of the banks, so they no longer needed to employ them, and we loved it. Now, I'm not suggesting for a minute that the same sort of power of data and technology will enable us to kind of shut our high street branches or make us into actual nurses, but there's an awful lot more that we could be doing than we're not. And the starkness of this challenge now is that the Nuffield Trust recently reported that, in its view, the funding gap in 5 years' time for the NHS will be about 40 billion. So we currently spend about 100 billion on health services. The actual true cost of health services will increase to 140 billion. We are not going to get any further funding from the Treasury in the next 5 years. So how do we close that 40 billion funding gap? And there's a good possibility we won't. But certainly, for sure, technology and well, frankly, liberating the economic asset value of the patient is going to be the most important real play we have. So NHS England, that's all kind of good rhetorical talk, but how are we going to effectively launch an entirely new, vibrant marketplace for data and technology in the NHS in the next couple of years? And we are moving at pace now, so we just do not have time to hang around any longer. Although people will say to me, well, what is the evidence that the public want to engage in a way they're not currently? There's loads of evidence, actually, that people do want to engage, and we're just going to have to take that risk. We're going to have to invite patients and the public to take a much more controlling interest in their own health, or we're not going to have an NHS any longer. So some of you will know, for example, that on the transparency side, I'm a bit of a data freak. I mean, that goes back to Dr. Foster, but 2 weeks ago, we made a very important early step forward, which was to working with the BMA and the RCGP. We have reached an agreement that means that vastly more data will flow from general practice than has ever been the case before. In fact, vastly more data will flow from general practice in England than anywhere else in the world, and that starts from now. That data will then be linked, can be linked to hospital data, and for the first time in our history, and indeed in the history of any national health economy, we will be able to track the patient across the pathway of their care, at least in primary and secondary care. This will have a very instant effect as a business intelligence resource, really, on galvanizing commissioners, providers, but also giving new opportunities for patients to take more control over how they manage their interaction with the health service. You'll see, I hope, a flourishing marketplace, not only of kind of, you will, I no doubt, be the people who will design these, but a flourishing marketplace of kind of management information tools for doctors and for commissioners, which you need to build, but you'll also see a vibrant marketplace of consumer applications, which will help people understand how they can manage their health better with this kind of reference data in the background. That's just one thing we've done. In July, actually later this month, we'll be publishing a consultation again. Hopefully you'll all want to participate, which will set a new standard for the comprehensiveness of hospital data that we need to flow. At the moment we have some, and it's good, but it's not nearly enough. And we're going to invite hospitals to now raise their game very substantially. That's all part of a new initiative, which we also launched a couple of weeks ago, to now seriously get to grips with the need to deploy electronic records in the NHS. So safe digital record keeping is a fundamental priority for NHS England. Again, I don't know if there are companies in the room who are in the business of making electronic records, but this will be an opportunity like none other. And we're not going to dictate which supplier a particular local health economy or local hospital may want to go with. We're simply going to set a standard which vendors will need to meet. And that standard is really simple. And the standard is simply that from April 2014, every NHS provider will need to provide data to commissioners that has the NHS number as its primary identifier. That is the only standard we're going to set. And people who do not meet that standard will not be increasingly commissioned for the treatment of NHS patients. So for some hospitals, that's going to be a gigantic challenge to go from sort of a myriad of different non-interoperable systems to a much more interoperable environment in which we can absolutely follow the patient through the pathway of care. We can understand what the pharmacological as well as medical interventions were, and that requires the NHS number to be the primary identifier. So that's just to sort of give you a sense of the commitment, and that will be a contracted requirement from next April. So on the one hand, it's about data, and it's about flows of data to sort of power the ability of patients and clinicians to get a grip. The importance of data, which sometimes escapes people, is that we can reflect that until the airlines industry had determined in common what Athens meant, both how to spell it and where it was, Expedia didn't exist. And it took an act of will on the part of the airlines industry to create common standards that did identify destinations in a way that could be referenced across all the different airlines, so that there was an opportunity for people to book centrally. That was a very expensive and complex piece of technical engineering, but the net result is that we again have taken on the role we have with the banks. We do most of the clerical work for the airlines now, and we are delighted. We're delighted with the convenience of it. Again, unless the NHS has data of a standard that will enable enable technology to truly be unleashed, we won't get anywhere. So data is our first priority. The second sort of big thing we're focused on is this concept of a paperless NHS. So meanwhile, as we build the sort of culture of safe digital record keeping across our hospitals and in our other care establishments, we also need to drive out the burden of bureaucracy on the one hand, and to make the NHS digitally recognise its customers. Again, some of you will have heard this, but I had really another eye-opening experience a few months ago where I met a lady who looks after a child with very severe learning disabilities, and she has, a really miserable experience with the health service. She goes in repeatedly to local A&E departments. They don't know who she is, even though the staff do. Institutionally, they don't know who she is. They have to fill in various forms just to go through the process every time she goes in. And the net result of the NHS not knowing who she is and not being able to remember who she is that every time her child is admitted for treatment through the A&E department, they end up waiting a couple of hours for the hoist to arrive that will lift the child from the wheelchair onto the bed for treatment. And that hoist should have been there when they turned up at A&E, but the hospital doesn't remember who they are. So actually the compilation of these hours and hours of waiting and the indignity of the kind of poor, pathetic customer service that hospitals in her area offer is demoralising to the point of being sort of, I actually described it as inhuman the other day. I mean, she was a very demoralised, very exhausted person thanks to the health service. I mean, it's just completely mad. It's as if we sort of leave our brains at the door when we come to the health service. We have high standards, we are demanding customers, we are active citizens in so many other contexts, yet when we come to the NHS, we leave our brains at the door and we become passive, subservient, and we don't demand the level of customer service we should expect. But the key to her dilemma was, and when I asked her what was the single thing I could do for her with this fantastic privilege of the job I do, was just sodding well make the NHS remember me, which we all can understand is a massive technological push, but we have to do that. So again, we have no time to waste, and really the paperless NHS, which the Secretary of State has challenged us to become a fully interoperable digital culture as well as service, is all about the NHS remembering that woman so that actually her child gets treatment when she needs it, and with a due and proper standard of customer service. So you'll see a lot about that. Today, Beverly Bryant, my colleague, is launching our new e-referrals program. I guess people may have heard a little bit about that. You'll be familiar with Choose and Book. Choose and Book just got off on the wrong foot. We had all sorts of problems with it. We've relaunched that as e-referrals. And one of the core objectives of that is to create a much more open, standards-based marketplace for vendors of all sorts to be able to pull and push the data that comes out through the e-referrals program to be able to develop all sorts of new products and applications. And one of our main priorities is that we develop what was Choose and Book, now e-referrals, into a simple app that will enable people to be able to just at home book an appointment when they wish it in their local hospital. We all know, of course, the reality will be, it'll be July. I mean, I just recently booked an appointment, and having struggled to find, to understand how Choose and Book worked, got the response that I'd have to wait until, I booked it in sort of April, it was at least 3 months, and sort of my net response to that was furious irritation. But actually, the more we use those sorts of services, the more the NHS will address the problem of capacity, and the more it will start, the more active we become. My belief very profoundly is the better the NHS will serve us. So e-referrals is an important part of that story. Equally important will be the new GP SOC contract. Again, we're going to set a new standard there. We have one of the world's most advanced digital primary care systems. That's been an amazing investment by the taxpayer over the last decade or so. We have a marketplace that, in my view, is not dynamic enough. We need more providers, more vendors in that marketplace. And what we've done to try and liberate not just the market for vendors coming in, but also the opportunity for third parties to develop new services for patients and for professionals, is to require all those who wish to compete for the new GP SOC contract to agree that they will all provide an open API on top of their systems that will enable third parties at no cost to access the data that comes through the GP SOC records. I hope people know what I mean by GP SOC, but effectively that's the electronic record infrastructure in primary care. And we need to open that to a new market opportunity, which is what we're doing in November. I think that'll turn out to be a very important new initiative. So there are some sort of outlines of our plan. It essentially boils down, as I said at the beginning, to transparency and participation. We have a chance to quite literally change the relationship between the patient and the NHS in a way that not only do we want to do, is a moral imperative, will actually save lives, but also will, I think, be the critical change needed to sustain the NHS in the future. So the lady at the back just told me I've got sort of 8 minutes now, ish. So please ask me questions if you have any about what we're up to. So perhaps we could start with the gentleman there.
Yeah, thanks for your overview of the new vision in terms of your applications. Just a quick question.
Would you just say where you're from?
My name's Victor Higgs. We're a medical device company.
Okay.
I just wanted to know why, in terms of the paperless NHS, you didn't. Obviously, you're looking at an open system, an open competitive market for people to come forward with solutions. I just wondered why you didn't think about a common standardised system that the government could offer that could actually be enforced rather than having a more fragmented view of the different ways, the solutions that are coming forward that could be utilised.
So this is a really fundamental point, and if I haven't been clear, let me be clear, that the way in which we believe we will most rapidly deploy the sort of technology that are going to unleash all the things I've talked about is if they are very locally owned. So what we're going to do is we're going to set some national standards, which will be vigorously enforced. but we are going to leave it completely up to the local health economy, whether that's a provider or a commissioner, to make the purchasing and commissioning decisions. So in a sense, I suppose, the cost of sale to industry goes up because you're going to have more conversations, but there will be a common standard, and I believe a much more vibrant marketplace than what we are not going to do is impose final solutions on the NHS. That's what we tried before and it just did not work. And actually, when you look around the world at examples of rapid deployment, successful deployments, meaningful deployments of technology, they have all depended on local commissioning of technology services within the context of quite simple but enforced national standards. Gentleman over there, perhaps.
Thank you. Thanks a lot for the talk. My name's Patrick Kerr from East Surrey Commissioning Group. Could you help us with a very small legislative problem that I understand commissioning groups not allowed to have NHS identifiable data. So if you could just unblock that one for us, it might make it much easier to do our job. Thanks.
So obviously all this, it's so much to talk about, it's impossible to do in half an hour, but obviously all this depends in very large part on a different kind of contract with the public. So we're saying to them that we want to change, we want to turn this into a world-class customer service. For that, we need your data. Now, I mean, I'm a really big advocate of the simplicity of the current now from April the 1st legal arrangements, which are basically that there are no circumstances in which identifiable data will be shared with anyone other than my doctor without my consent. That is the law now, and it's clear and clean. Now, we've got some operational issues as a result of that, because in the old world, that wasn't what happened. In the old world, people were doing, as a variety of perfectly understandable local data sharing arrangements. Some of them were sort of legal-ish, others weren't really legal-ish either, but that, and now we are resolving with CCG colleagues and with local area team colleagues just what it all means. The good news is that, I can't go into the detail, but that it's not as bad as it looks. And I spent yesterday with Tower Hamlets CCG, and we went through exactly these issues. Guidance is being issued, I think even today, by one of my colleagues on what you can and can't do. But we do believe that the sort of legal infrastructure is the basis on which we can have a new conversation with the public about their data. And the bottom line is, it's their data. But ask me afterwards, I can give you some, yeah. One more question, yeah, chap there.
Hi there, my name is Dr. Ismath. I'm a local GP in Newham. You made the example about industry standards in banking and security.
Yeah.
So this is naturally the patient's concern, that once you go to a system which is internet-based or their access is through an app, how secure is that going to be? And that's going to greatly affect uptake and confidence.
Well, so here's an example. So does anyone here know the blue button? So the blue button is an American standard for downloading patient records, and it's becoming a kind of movement in the US now. There are literally hundreds of thousands of people in the US who are pressing the blue button on different apps, and that blue button basically allows you to extract your patient record and store it wherever you like. And if you don't know about blue button, it's worth having a look, because we're going to be bringing it to the UK. We think it's a brilliant sort of brand concept for a complex piece of kind of technology in a way. I'll come back in a second to your question, but one thing I didn't mention is that we are committed to, by May 2015, to giving every citizen in this country online access to their GP records through, as it were, our version of the blue button. That is a hard stop. We will do that. Now, you're absolutely right. People are going to say, on what basis can I trust, the system to manage my data effectively if I give my data to a third party to usefully, I don't know, marry it up with my gym data or whatever other data I want to marry it up with? On what basis can I trust the safe handling of all that data? Obviously, there are standards, and you will be able to. But just to give you that example from the US, we've gone from a culture which is even more skeptical than we are of the state and its apparatus kind of safely handling their confidential data, responding to the idea of having access to patient records in an immense wave of enthusiasm. They're now targeting 100 million people by the end of, in 2 years' time. So I think it's a really proper question, but actually people seem to quite quickly, as we have with financial services, kind of just trust the sort of security that does exist. Anyway, I better leave it there. Thank you all very much indeed for coming. I hope you have a good show. Thank you.